recording the session, so if you have just joined us, please do remain on mute and do turn your cameras off. There will be opportunities to ask questions session, so do pop them into the chat, and Dr. Clare and I will answer as many of them as possible at the end of the session. So we're going to get started. And Dr. Clare, thank you so much for joining us again. This is our third time together on screen, which is fantastic. Dr. Clare is a registered menopause specialist. She's also a GP, as well as one of the co-founders of My Menopause Centre, which is a clinic dedicated to empowering women through their menopause journey. So thank you so much for joining us again there. My name is Christina Salcedas. I head up education globally for Aromatherapy Associates. I am a wellbeing therapist and aromatherapist, and I have been with the brand now for over 13 years. Our Aromatherapy Associates has been a wellbeing brand, a spa wellbeing brand, blending essential oils for nearly 40 years. We are a B Corp brand, meaning that we work for people and planet as well as profits. And one of our most kind of topics of choice really is sleep, being that our best-selling product and blend is a sleep blend created by our founder, one of our founders, Geraldine Howard, during her time of trouble with sleep. Now we know how important sleep is. It's a foundation for sort of optimal health, really. We naturally need to do it. It is vital, like air and water. It is vital to our survival, shall we say. But unfortunately, due to various bad habits and our environment around us, we do find ourselves, many of us, with trouble sleeping. And actually, in the case of menopausal ladies, there's around 60% of menopausal women who say that they have issues sleeping. So can we start with, actually, Dr. Clare, why is sleep so important? Because we know it is. I think, I remember hearing a really kind of interesting fact that we're the only mammals that delay sleep. Every other mammal will lie down when it gets tired, find its little corner. What is it so important about sleep for us to know about?
Yeah, so first of all, it's what is sleep, what sleep is not. And sleep is not an inactive process. Sleep is a really active process where our body is really active. It's restoring itself, it's repairing itself. So there's actually a lot going on while we are sleeping, which is why it's so crucial. And if we think about the consequences of lack of sleep, they sort of fall into lots of different categories. But sleep is really important because without it, we know there's increased risk of sort of emotional disturbance, increased anxiety and low mood. It has an impact on our ability to cope with everyday life, which I'm sure we could all identify with, on family, social work. There's a really big issue with sleepiness and fatigue. So when we're tired, we're more accident prone. So we know we're more likely even to have a car accident. We know increased low mood, increased irritability, but also people don't appreciate that sleep has an impact on our physical health as well as our mental health. And so with poor sleep, increased risk of type 2 diabetes, heart disease, obesity. There's an impact on our immune function. There may be an impact on risk of certain cancers, high blood pressure, lower threshold for ill health. So sleep is really important, as you can tell from that sort of wide range, what happens if we don't. It's really crucial for restoring ourselves, body and mind.
Yeah, absolutely. No, it's interesting that you say absolutely. People often think that obviously we're not doing anything when we're sleeping. We're not, but certainly our body is, and it is super important. So tell us, how much sleep do we need? There's lots of figures around. What would you recommend is the sort of the best? How long do we need to get a good night's rest?
Yeah. So if you read newspapers, etc., you'll see different figures. And in actual fact, the amount of sleep that we need does change with age. So as we increase in years, we probably need less sleep, and certainly sleep quality changes. On average, for an adult, it's around 7 to 8 hours. But that varies hugely. And this is why we should try not to get hung up on the numbers themselves, because although we can say 7 to 8 hours, actually I might be fine on 6 hours, you might need 10 hours. So it's understanding what is right for you as well, because getting hung up on that number can actually impact on sleep. As I'm sure you're lying there thinking, oh no, I haven't had my 8 hours, it's going to be a disaster. It probably won't be. Yeah.
That's, yeah, do you know, it is one of those things that you do take so much, you pay so much attention to those numbers that sometimes it can kind of be it can be overwhelming. But you mentioned the changing in age. So ideally, you know, around the time when we're menopausal, would we still say those 7 to 8, or you have to kind of figure out what is best for you?
Yeah, so on average 7 to 8, but absolutely you do need to figure out what's best for you. Yeah, you know how you feel, don't you?
Yeah, absolutely. I remember once reading that they generally say that it's at 11 o'clock, see how you're feeling. If at 11 o'clock you're exhausted, then it wasn't enough. I don't know if that's something sort of scientifically proven, however. So tell me, in terms of menopause, what are the common difficulties with sleep?
Yeah, so in the menopause, anything can happen. So the common difficulties are sometimes getting off to sleep. Nighttime waking is incredibly common, and we know that that occurs more frequently between 3 and 4 a.m. from studies. And so waking up not feeling refreshed. So it's getting to sleep and staying asleep are the key difficulties in the menopause.
Okay. And the staying asleep, what kind of things would it affect the staying asleep? Is it that kind of the worrying mind? Would it be other things?
Yeah, so in terms of impact on sleep of the menopause, the reasons are so many. And again, I think it helps to lump them into categories. So there can be a direct effect of the loss of hormones. So we know that estrogen is needed for certain depth of sleep and quality of sleep. And if you give estrogen back, it can improve those parameters. So we've got the loss of estrogen and to some extent loss of progesterone, the other hormone made by our ovaries, having a direct effect. And then we've got the impact of symptoms. So it might be night sweats, hot flushes, bit tossing and turning, being really hot, palpitations, muscle aches and pains, and then anxiety and our lower resilience to stress can keep us awake. And then some women sadly have really low mood and early morning awakening. So you can that direct effect and then an indirect because of the symptoms. And then you can get into this awful vicious cycle where you're worried about your cognitive symptoms in the daytime. You know that if you don't get a good night's sleep, it's going to feel worse and you're a little bit anxious. And so you can see how this sort of negative cycle gets set up.
Yeah. So tell us, what can we actually do? What would help that? Because obviously yeah, as a woman, you know how important sleep is. You're trying to do your best, but obviously whatever it is against you. What can we recommend to get a better night's sleep? It might not be every single night, but what can we recommend for a good night's sleep?
Yeah, so in the menopause, if HRT is something that you want to take and you don't have any contraindications, then there is evidence that HRT can be helpful. So that is a medical approach, sorts most menopause symptoms out for most women, not all the time, but that is one good way. And then it's sort of, if we think about lifestyle things, that then it's really interesting to sit down with somebody like myself. We would sit down and just work out from the minute you wake up to the minute you go to bed and what happens in the night, what's going on. So if we think about the daytime and lifestyle, it's not drinking caffeine after lunchtime because caffeine is a stimulant, lingers for a long time. Smoking, nicotine as a stimulant can keep you awake at night. Avoiding eating a heavy meal before you go to bed and avoiding spicy food, they can all have a positive impact. And we're really talking about positive marginal gains here to get you better sleep. Before you go to bed, I know, Christine, you're going to talk a little bit about aromatherapy associates and relaxing sleep bands, but you know, it's basically setting yourself up to relax at bedtime. So good sleep hygiene, good rhythm, good routine, and relaxation before you get into bed.
Sure. You know, I think it's the idea of just kind of deciding you're going to bed and lying there and thinking, you know what, the body's just going to do what it needs to do. Actually, it doesn't quite work that way. I think as we kind of, you know, go through life, I think that the term that you've just used is quite important, and we actually do educate our therapists in this, which is sleep hygiene and what that actually means. And as you said, you know, we know that blue light isn't good before, you know, if we are suffering, you know, with sleep, if we are, you know, struggling, then yes, you know, we should be avoiding our blue light. And I've heard sort of about 2 hours before bed. And again, this kind of, you know, gauge with yourself how long you need. But doing something a little bit that's not in front of a blue screen also kind of helps. The fact that you know, creating, we always say, create your room should be a sanctuary to sleep. Like, it should literally be, I go there to find myself again and, you know, rest and repair, because that's effectively that's what our body is doing when we're sleeping. So, you know, creating that lovely sanctuary. And yes, obviously, you know, aromatherapy has been used for centuries. You know, and I always say that if something has, you know, stood the test of time, there must be something in it. And now it is, you know, there's lots of scientific evidence to show actually how essential oils work. You know, obviously they get absorbed into the skin when you apply them, and then navigate the body. Depending on what oil you use will depend on the effect that you will get. But also the link between the sense of smell and the brain, bringing back memories and how you've been feeling. You know, if you've been to a spa for a treatment, for example, and the oil that they use, you use again at home, that will already start to evoke feelings of relaxation and de-stressing. So 100%, I hear you when you say sleep hygiene is super important, and incorporating essential oils is an easy way to actually support that and kind of allow you to unwind. Everyone, you know, generally says, oh, you know, that smells so lovely, it smells like a spa. Then utilize that. I think it's kind of making sure that, and pick something that you love. Either something you love or you know that actually works. I'm sure, Dr. Clare, I'm sure you've already tried our Deep Relax blend. It's it is our best-selling blend, and it has been for nearly 40 years. It was created by, it's actually what's pictured here. It was created by our founder, one of our founders, when she was found taking sleeping pills actually for sleep problems. And I think, no, go and blend an oil for yourself. And thank goodness she did, because nearly 40 years later, here is our Deep Relax still. So sandalwood, vetiver, chamomile are what make up this blend. And for those of you that don't like lavender, you'll be pleased to know there's no lavender in sight here. Vetiver being the key ingredient here. Vetiver is a grass. We actually get the essential from the root, macerated, it's dried up, and it has a beautiful sedating effect. So really kind of knocks you out and gets you off to good night rest. Chamomile, super calming for skin and mind. Sandalwood, super grounding. And there's lots of ways that you can use it. So it's not necessarily that you only have to use it in one way. There's lots of ways that you could use it. First of all, in terms of a sleep ritual, which again I think should be part of a good sleep hygiene, is a ritual. So you can actually automatically, your brain clicks into, okay, this it's time to rest and repair. It's time to stop. So for example, lighting a candle, really super easy. In a nice sleep routine, light a candle maybe an hour or two before bed. When you arrive in your room, it smells beautiful. Equally and easy to use, for example, our atomizer with a pure essential oil and blend. It's portable, it's waterless. It uses nebulizing technology to actually diffuse essential oils into the air, so none of that sort of wet dog smell after the essential oils have all diffused. So preparation of the room, essential oils or a candle is lovely. Bathing, actually, do you know what? In terms of bathing, people are kind of, the jury's out with bathing. What would you say would be better? Something in the shower or a bath? Because I know that sometimes people say, oh, you should be bathing because it gets you too hot and then you can't sleep at night. What's your take on bathing, Dr. Clare?
I think you've got to do what you prefer. I don't think there's any scientific evidence one way or another, and I think you do what you want to do. That's
Lovely.
what I would say. Yeah.
You know, I think most things that makes complete sense, quite frankly. So bathing, generally, I know there is scientific research to say that it allows the body to relax, and that enables sort of the stress hormone to be released and to lower. So bathing, your next step would be a nice shower or a nice bath. Using the bath and shower, so up to 30% pure essential oils, applying it to your chest, your abdomen, shoulders, lower back. going into the shower or bathing in the bath, at least sort of 20 minutes to enable yourself that time to just switch off, release any kind of tension from the day, and just give you some time to yourself. As you come out of the bath, I'm a firm believer of my products working harder for me. You know, yes, apply something to, obviously during menopause, again, your skin does have a tendency to dry out. So applying something onto the skin is really important. Obviously being very careful, because I know that obviously HRT shouldn't be applying anything on top of the HRT. Is that right, Dr. Clare?
Yes, really good point. So if you're rubbing on estrogel, and that's or Sandrina gel, if you're using the Lenzetto spray, then you need to wait at least 2 hours before you put anything on the skin. And if you're using patches, just really avoid the area with the oil, because it may just lift up the edge of the patch. So really good point to bring out, Christina.
So again, avoid the patch, or don't apply obviously on the area of your gels, your HRT gels. But yes, there's 2 different ways that you could apply the blend. One would be in an oil. So if you prefer a kind of a nicer, richer texture, the oil is beautiful, really, really helpful to keep skin nice and soft and supple. Or if you prefer a cream, which is my favorite, the Deep Relax Nourishing Body Butter with Gotu Kola oil is super, super velvety, really easy to absorb into the skin as well. Keep a pot of it by your bedside table, even if it's just on the hands and the feet at the end of the day before you kind of get yourself off to a good night rest, I think is a perfect sort of three-step routine to a good night's rest. On that note, I'm going to very quickly revert back to some questions, Dr. Clare, because I think hopefully there'll be some that have come up, so bear with me for a few moments. We are, first of all, go. So we have on oil recommendations. So in terms of oils, if you are talking, if there's anything besides Deep Relax, so Deep Relax obviously is it's the one to go for. Definitely, if you need to have a good night's rest, that's the kind of one that I would definitely recommend. We do have a couple of other blends that are beautiful. Light Relax is very nice. It is more, it's a lighter fragrance. You've got your Lang Ylang in there, you've got Petitgrain, it's uplifting. I always like to describe it as taking the edge off the day. So where a Deep Relax will kind of just knock you out, you want to get to bed quite quickly. Light Relax, almost like having a glass of wine at the end of the night. Just allows you to unwind, but you can still function and do things that you might need to do around the house. Equally, Dr. Clare, you mentioned obviously if you need to quieten the mind before bed, de-stress mind, frankincense, chamomile, and petitgrain is beautiful. So that's another alternative. And those actually also come in shower oil, so you can actually cleanse your body with those. So it's like an oil to milk foaming cleanser, which is beautiful. So lovely. Yeah, thank you for that question. Dr. Clare, actually going back to the HRT, can you just remind us the gels when they're applied, because obviously I mentioned that you apply the oils where you haven't applied your HRT. Can you just remind people where they should be applying their HRT gels if that's what they are using?
Yes, of course. So for example, estrogel is the pump gel, and you put a squirt onto your hand. And then, so one squirt goes in one location, and you rub it down the back of your arm. Just rub it up and down 1 or 2 times, and then allow it to dry. And then if you use a second dose, dollop on hand, and then down the back of your other arm. And they do take about 5 minutes to dry. And if you don't wait for it to be fully dry, actually the absorption, you do rub a significant amount off. So if you're using gel and you're finding it's not quite working so well for you, it is worth just reviewing how well you're allowing it to dry in the morning, or you can use it in the evening, but yeah, don't cover it till it is dry.
Lovely, thank you so much for that. We've got another question we have. So Daryl finds it difficult to switch off at night. Any suggestions for unwinding whilst in bed? Clare, yeah, whilst in bed, unwinding.
Yes, so there's really good evidence that cognitive behavioral therapy is helpful for poor sleep. either as well as or instead of HRT. And one of the things about cognitive behavioral therapy really helps you break those vicious cycles that get set up. It really looks at the link between how you feel about a symptom and the impacts that that then has on the symptom. And as part of CBT, or even you can do this without having CBT, learning how to really switch off by doing deep relaxation breathing, or sometimes it's called abdominal breathing. So in bed, and if you do any yoga, they'll again teach breathing techniques. I think that's a good way. So totally non-medical. I've just discovered some recordings of the sea, which I quite like, but that will be different for everybody, or reading a book. I think your point about avoiding screens is really important, though, because when we use particularly a bright screen, like on an iPad, it can actually trick your brain into thinking it's still the daytime, and you don't release so much melatonin in your brain, which is a hormone that is needed to keep you asleep. So yeah, they would be my top tips, but somebody else might equally have different top tips. So they would be mine.
I will agree with you on this, on the breathing. We actually have a beautiful treatment that we created called the Relax and Sleep treatment. It's available in some of our spa partners, and incorporated into that treatment, we do actually have a breathing exercise, because we know obviously when you start to sleep, or when you sleep, your breathing is very different. It is deeper and slower. So by almost you're almost like tricking your brain by doing these, you know, slower breathing techniques or deep abdominal breathing techniques. I find them, and a really easy one to do, Daryl, is box breathing. We do it a lot within our treatments. So breathing in for 4 seconds, holding that breath for 4 seconds, breathing out for 4 seconds, and holding the breath out for 4 seconds. So box breathing, super easy, and you can do it in bed. Maybe actually add in a little bit of a mist, of the sleep mist, which is quite a nice one to have again by your bedside. So just mist it onto yourself, do your breathing exercises, and just kind of as much as possible, unwind. But that's a good question, because I know that it can be hard when you do end up waking up, for example. It's always quite difficult to get back to sleep. We've got another one for Dr. For you. Oh, did you want to add something to that?
Yeah, can I just say something quickly? I didn't mention, so back of arm, because obviously we've been talking about arms, but you can put gel on your inner thigh, not the front or the side of your thigh. It is the inner thigh. So sorry, I should have mentioned that when we were talking about gels.
No worries. And remind us again, the reason it's all inner thighs and inner arms is because the skin is thinner on that area, so it's a better absorption. Is that correct?
Yeah, it's where it's been studied. Basically, the product, the gel, is designed to permeate through the layers of the skin, where it's then picked up by the tiny capillaries that lie underneath the skin. And so we know how it is absorbed. We know the rate of absorption for the inner thigh and the outer arm. It may be absorbed in other places, but we just don't know how well. So that's the reason why it's in the licensing marketing information from the drug companies.
Just
somebody maybe not on mute.
Another one for you, Dr. We've got, what types of products or nutrition would help with the reduction in collagen and estrogen during menopause?
Yeah, so from my medical evidence-based point of view, really it's adding back estrogen. So we know that estrogen in HRT can help improve the integrity of collagen, and that's because you need estrogen for good collagen, if you like. And through the menopause, the quality of the collagen does decrease, and giving estrogen back can help that marginally. I know lots of people take collagen supplements, and the evidence around them is not brilliant. A lot of the time it's because nobody's done really huge studies to look at it properly, and just because there isn't any evidence doesn't mean it doesn't work and that it's unlikely to harm. But with my doctor hat on, I would say just replacing the estrogen. Weak plant-based estrogens, so phytoestrogens like red clover, isoflavones, and soy, can be helpful in managing some symptoms of the menopause, but we don't know enough about those. They're very weak versions of estrogen. We just don't know if that does help skin and collagen.
Okay, lovely. Thank you so much. Very quick question from somebody. Is the gel better on your arm, or is it better on the leg? So arms or legs, or is it just as somebody prefers?
Yeah, it's just what you prefer. We know it absorbs on the outer arm. We know it absorbs in the inner thigh, and you can choose. Some people say, you know, they prefer in the winter getting dressed on the top half and putting the gel on the thigh and waiting for that to dry. But whereas others will say that they get dressed on the bottom half and they put it on the arm. So it's whatever suits you.
Okay. And in terms of skin dryness, so obviously during menopause, one of the kind of symptoms that people do comment on is dry skin, itchy skin. Why does that happen, and what can we do to kind of help that?
Yeah, so that's right. And brittle nails. I've had a number of patients recently have said their nails have also become more brittle. So it's tricky. I don't have a good sense as to whether HRT helps dry skin. A lot of women come back and they say my skin is still dry. So I think it's looking at the right emollient or moisturizer that suits your skin. If your skin is very dry, it may be worth going to the chemist and looking at some. So the emollients that we prescribe contain paraffin, basically, and are just really thick and oily. But I know that there are much nicer moisturizers that you can use, and you may not need that degree of oiliness. If you suffer with eczema, you might. But I'm using something that you like to use. I would go to products that you put on your skin if the HRT is not helping.
Do you know, interesting that you've mentioned brittle nails, actually. So we've just designed another treatment called Pause and Reset, which was it's yes, mainly for people who are perimenopausal, menopausal, but also anyone suffering from any kind of hormonal imbalances. And one of the sort of special touches that we actually added into that treatment is we apply a specific oil to the cuticles, and a hand mask and a foot mask to the feet as well, for that particular reason. That we found it quite interesting that there was a lot of people talking about this brittle nail. But in terms of if you are looking for something for dry skin, from our perspective, 100% we would recommend the Relax Body Oil. If you prefer that kind of oily consistency, it is lovely in a pump formulation, so you can really easily apply it to the skin. It absorbs into the skin fast as well, so it doesn't leave that greasiness. You can then layer on a cream, the body butter, so our Deep Relax Sleep Well Nourishing Body Treatment on top, or like I said, you can use either or. And again, my recommendation is having this by your bedside table, because if you haven't got time to do everything, at least hands and feet. It's a nice little self-care thing for yourself at the end of a busy day. We have oh, one second, we've got another question. If there was one thing, Dr. Clare, one thing that we can do to help us sleep better, just the one, what would it be?
Oh, that's a really good question. Apart from HRT, which can help, not always, I would say have a plan for the middle of the night when you wake up, because I think that is the worst thing, when you wake up at 3 a.m. and you just lie there and you can't get back to sleep. I would have a plan, whatever that is, whether it is using something, a fragrance, whether it's plugging in and listening to something, whether it's getting up and making a non-caffeinated drink and then going back to bed. I would have a plan for that 3 a.m. Don't just lie there ruminating and feeling stressed and increasingly stressed about the next day. Do something and have a plan for what you're going to do when you go to bed.
That's lovely. That's such, yeah, that's a very, very, very good sound piece of advice, actually. Very sound. We have another question, actually, if there is any other blends that would help with mood going through menopause. So from our perspective, the key blend for mood would be our Support Equilibrium. Support Equilibrium has Beautiful Rose, which is an uplifting blend essential oil. You've got Geranium, which is also your balancing essential oil, and Frankincense, which helps to focus. And that was the particular blend that was created in clinic by the founders for somebody who had come into clinic with, or presenting themselves with hormonal imbalances, just not feeling themselves, which is we now kind of have labeled sort of perimenopausal, menopause, menopausal. So Equilibrium 100% would be my go-to blend if you are if your mood is low. It's a beautiful blend, really lovely and floral, and yeah, it's bath and shower, or you can use it on the torso before you go into your shower and wash as normal, or apply it and then soak in the bath as you would normally with our bath and showers. And that can either be bought as a full-size bottle, or you can actually buy it in the collections that we have, so the mini collections, discovery collections, and the ultimate discovery collection. Lovely. Dr. Clare, in terms of nutrition, so we're just returning back to another question about the collagen. Anything in terms of nutrition, what would help with the reduction in collagen and estrogen during menopause?
Yeah, so in terms of nutrition, so again, when you're eating something in a diet and you're eating the sort of a natural diet, the amount that you get is minute. And so although we've got evidence from women in Southeast Asia to show that if you have a lot of soy in your diet particularly, then it may help hot flushes, that actually you need to eat quite a lot. So I'm not a nutritionist, I'm a doctor, but from a doctor's point of view, the amount that you actually need to help symptoms is quite high. And so the general nutrition advice, so there are two bits to this. So we all need enough vitamin D, and that's really important. So found in particularly oily fish, etc. We need vitamin D because with the loss of estrogen, our bone density can start to decrease, and vitamin D helps us helps us absorb calcium. So a vitamin D supplement, and ensure that you've got enough calcium in your diet, because that's the building blocks of your bones. And if you're not sure how much you need or whether you're eating enough, there's a really good calcium calculator on the International Osteoporosis Society website. There's a Royal Osteoporosis Society in this country, but the international one is a bit more detailed. And then we know many women start to gain weight due to the loss of estrogen and start to redistribute fat around the middle. And the dietitians all say that a balanced diet is so important. So if you're looking at a plate and you divide it into four, having half either vegetables or fruit, whichever is most appropriate, having a quarter protein and a quarter carbohydrate, 3 meals a day, 2 small snacks is really important for keeping your blood sugar on an even keel and helping you not feel hungry, so you're less likely to reach for slightly less healthy snacks. But in terms of specifically for collagen, that there isn't really anything that I can say that, right, if you eat this, you will not lose collagen. Unfortunately, it does occur, but what you have in your diet is unlikely to be enough to completely combat that. A nutritionist may say something slightly different, but from a medical point of view, that's what we would say. Does that answer the question?
Yeah, do you know what? I'm hoping it's enlightened me, certainly.
Yes.
One other question. Someone's actually asked about our pause and reset treatment, and I will go on to that shortly. What's the best thing that you can do for your hot flushes during the night? So if it's the hot flushes and the night sweats that are kind of keeping you awake or stopping you from getting to sleep, what's the best advice that you can give for anyone suffering with those?
Yeah, so hot flushes and night sweats can be anything from feeling of a glow to being drenched in the middle of the night, wet sheets, wet bedclothes, wet night clothes. Yeah, so I hear many women waking up many times. And so the first thing is consider HRT, because that is the most effective way of managing them. If you are on HRT and you're still having hot sweats, go back to your doctor, because you probably need a change of dose or a change of type of HRT. So don't put up with symptoms ongoing just because you're on the HRT. It often needs tweaking. Then, as you touched on earlier, Christina, making sure that your room is cool and dark and well ventilated, having cotton bedclothes, having a nightie on, it sounds a bit funny, but if you go to sleep with nothing on, which you obviously feel like you need to do because you're boiling hot, actually, if you have a fabric over your skin, it can pull away the sweat and can be more comfortable. There are various products around, so anti sweat wicking types of fabric, again, that are designed to pull the sweat away from you. Some women tell me that they keep a pillow in the freezer, and then they whip their frozen pillow out and swap it if they wake up, and keeping a spare set of everything by the bed. So you know how I said, be prepared for waking up.
Yes.
So if you've got everything by your bed, so there's minimum disruption, you don't have to get up, put a light on, etc. So they would be my top tips.
That's
there is other medication that's not HRT, and there is the new drug Veoza, which unfortunately is only available privately at the moment, but that shows really high effectivity of it's not a hormone, and it does help hot flushes. So there are lots of options.
I'm gonna add to your little list. I'm gonna say the lavender and peppermint blend, which we have. It is only in a bath and shower oil format. Lavender is great for skin generally, but peppermint is super cooling. So that would be my recommendation. So a capful of that onto the torso before you go to bed and in the shower, just to cleanse the skin. That would be my recommendation. Yes, we've had a lot of interest on our pause and reset treatment. So the pause and reset treatment it is a 90-minute spa treatment available in various different spas that we work with. It is it's both a body and a face treatment, because what we looked at when we were researching for this treatment, we wanted to kind of tick off as many of the symptoms that our customers would be coming to us with. So yes, we have actually stipulated in the protocol cotton sheets, for example, no duvets. Obviously, generally in spas, you're nice and kind of swaddled in towels and blankets. We have said absolutely no, none of that. Nice, cool, a cool mitt in case the client does have a hot flush. You can pop it over their forehead, for example. We actually smell test the guest with 3 oils that we know are particularly good during menopause, which is the equilibrium for sort of hormonal imbalances. The lavender and peppermint, very good for any hot flushes. Also particularly good for digestive issues, because I know sometimes during menopause you may get sort of changes in your digestion. And equally, we've got De-Stress Mind, which is our blend to help kind of keep you focused for those clients that are suffering kind of with that brain fog or stress and anxiety. So those 3, I'm just going to very quickly remind you, if anybody hasn't muted themselves, we are recording our session, so I can get you to mute, and that'd be great. So yeah, those 3 blends are what our therapists are taught to smell test. In terms of the treatment, we start actually with a body brush exfoliation. So again, supporting that extra dry skin, for example, during menopause. So body brushing kind of eliminates all those kind of dead skin cells off the surface of the skin. We then apply a gel to keep you nice and cool, and then your oil and cream for the massage. We then we work on the back. We do a lovely massage with lots of pressure points to help balance up the body, and then turn you over. We do a lovely abdomen massage as well. Again, we want to really kind of target the sort of emotional center of the body. So we do an abdomen massage, and then we finally finish up on the face with a lovely kind of discovery facial. So we cleanse the skin, we exfoliate, beautiful massage, lovely scalp massage as well to release any tension. And yes, after 90 minutes, you are a completely different person.
That sounds heavenly. That sounds lovely.
I have to admit, it is now one of my new firm favourite. We've got one question, slightly different to what I was expecting. So someone is asking, my friend has lost her sense of smell. Is there anything that you can do, Dr. Clare, could recommend that might help with smell training or helping to sleep with the scent benefit, without the scent benefit, sorry?
Oh, that's really interesting. I think if she's lost a sense of smell, I would speak to a doctor, and it may be that needs checking out. You can lose your sense of taste and smell, or it can diminish in the menopause, and we know it diminishes with age. But I would check that out medically. Just for interest, I'm talking to an ENT surgeon tonight through my menopause centre, and I'm going to be asking her about tinnitus and smell, etc. but there's nothing that I can suggest without knowing why she's lost her sense of smell. And I would encourage her to go to the doctor and get that checked, please.
Lovely. That's perfect. Thank you so much, Dr. Clare. So we have come nearly to the end of our session. Dr. Clare, thank you so much. Every time we do a session with you, I learn something new. So thank you so much for all that. I do hope that you have enjoyed the session and have picked something up you can take away with you today to get yourself off to a better night's sleep tonight, whether it be taking a bath, or if it's just switching off that phone and that iPad that hour earlier before you go to bed. Just a little reminder, we have a beautiful complimentary relax and unwind self-care kit online at the moment. It's worth £56.50 and it's free when you spend £80 online on our website. So do pop over there and take a look at that. You do actually get a little small size deep relax nourishing body butter that I mentioned in today, and also a small size deep relax. So you get at least 2 products that you can try to see if they work for you. So Dr. Clare, again, thank you so much. And we will see you again soon. Thank you everyone for joining us. And yes, look out for more events on our social media and on our website. Take care, everybody. Have a nice afternoon.
Bye.